Welcome back guys. Now in this video let's discuss about basal ganglia. Okay, so basal ganglia. Now first of all, this basal ganglia, the name itself is a misnomer. Okay, why? Because this basal ganglia should be called as basal nuclei. Okay, so what exactly the ganglia mean? The ganglia mean collection of neuronal cell bodies in the peripheral nervous system. We have the dorsal root ganglia. So ganglia is a word which should be used in peripheral nervous system. The collection of neuronal cell bodies in peripheral nervous system should be called as ganglia. We have dorsal root ganglia, sympathetic ganglia. We know. Okay, we can name it. But here, these basal ganglia are the structures which are present in the central nervous system. So these basal ganglia structures should be actually called as basal nuclei. It's a misnomer. Okay, nuclei are the collection of cell bodies in central nervous system. In central nervous system, the collection of neuronal cell bodies is called as the pieces of neuronal cell bodies is called as the basal is called as a nuclei. So it should be called as basal nuclei. But anyway, now first of all, let's discuss about the basal ganglia. What is the importance of basal ganglia and what are the components of basal ganglia? See, first let's discuss about the components. Basal ganglia consist of which structures? Basal ganglia, it consists of caudate nucleus. Okay, basal ganglia consists of a nucleus called as caudate nucleus and putamen. All these are the structures which are present deep inside the brain. Okay, all these are the structures which are present in the deep inside the brain. So caudate nucleus and putamen. Now these two structures are called as striatum. Okay, these two structures are called as a striatum or neostriatum. Okay, caudate nucleus and putamen together, this is called as a striatum. Now this striatum, what it is doing? It produces a neurotransmitter called as a GABA. Okay, so most of the structures in basal ganglia, they produce GABA only. Okay, most of the time the basal ganglia is inhibitory in action. Inhibitory in action. For example, if you ask me, sir, what is the function of the basal ganglia? Basal ganglia, it inhibits the movement initially, like whenever the movements are not needed. Okay, it inhibits the involuntary movements. For example, imagine you are simply sleeping like this. Okay, you are simply resting. Okay, you are simply resting. During resting, do you want any movements? No, we don't want any movements until unless if you need it. Okay, so basal ganglia, what it will do? It will inhibit the motor cortex. See, normally motor cortex is there. It's all the time there. So upper motor neurons are there, lower motor neurons are there, neuromuscular junction is there, muscle is ready, everything is ready. But still, who is inhibiting the movements? It's the basal ganglia. Basal ganglia inhibits the motor cortex. So unnecessary movements or involuntary movements are inhibited. Okay, so basal ganglia, by producing the inhibitory neurotransmitters, it inhibits the motor cortex and prevents the involuntary movements. Okay. Now let's see. What are the components? Yes, we have discussed caudate nucleus and putamen together called as the striatum. The neurotransmitter which is produced by this striatal neurons is the GABA. Okay, and the striatum is considered as the input of the basal ganglia. It's the input. Okay, it's the input. So striatum is considered as the input, and the structures which are present in like other structures of the basal ganglia, they are called as the globus pallidus. Okay, globus pallidus. Now actually it's present in the lentiform nucleus. Okay, lentiform nucleus. Now this globus pallidus, it is divided into globus pallidus internus and globus pallidus externus. Okay, see this putamen, globus pallidus, both of them are called as lentiform nucleus. Both of them forms a lentiform nucleus, but anyway, that's not needed now. Okay, this globus pallidus is again divided into globus pallidus internus and globus pallidus externus. It is also producing which neurotransmitter? GABA. Okay, inhibitory neurotransmitter. Done. Now, there is a structure which is present in the brainstem, or I should say the structure which is present in the midbrain. There is a structure which is present in the midbrain. Now, this structure is called as Substantia nigra. Okay, Substantia nigra. Now, this neurons, the neurons which are present in the Substantia nigra, they releases dopamine. They are dopaminergic neurons, not GABAergic neurons. They are dopaminergic neurons. Now, the Substantia nigra, it produces a neurotransmitter called as dopamine. Done. Okay, now the Substantia nigra is divided into two parts, pars compacta, pars reticulata. So, Substantia nigra is divided into pars compacta and pars reticulata. What they will produce? They will produce dopamine. Okay, now one more structure which is called as a subthalamic nucleus. There is one more structure which is present in the basal ganglia. That structure is called as the subthalamic nucleus. Now, what the subthalamic nucleus is doing? Actually, this is the one substance, or this is the one part of the basal ganglia which is actually producing the excitatory neurotransmitters. Okay, so the subthalamic nucleus, it produces what? The subthalamic nucleus, it produces a neurotransmitter called as a glutamate. What it does, it excites. So the excitatory neurotransmitter in the brain is called as glutamate. Okay, so now, what are the three important neurotransmitters which are produced in the basal ganglia? The three important neurotransmitters are, one is the GABA, second one is the dopamine, and third one is the glutamate. Okay, GABA is coming from the striatum, GABA is also coming from the globus pallidus internus and externus. Dopamine is coming from the substantia nigra, and glutamate is getting produced from the subthalamic nucleus, and it is the excitatory neurotransmitter. Okay, now after this, let's discuss about the pathways. There are two important pathways. Okay, there are two important pathways in the basal ganglia. One is the direct pathway, another is the indirect pathway. First itself, here itself I am telling you, see, the direct pathway, okay, direct pathway, it facilitates the movements. Okay, it's facilitating the movements, it starts the movements. Okay, for starting a movement, for example, like this, okay, like this movement requires the direct pathway. For example, see what exactly happening in the direct pathway. Okay, here are the two pathways, the direct pathway and indirect pathway. Two pathways are seen. In direct pathway, you can see there is this one network. Okay, there is this one network. At the end of the day, in direct pathway, what is happening? Please concentrate here. In the direct pathway, see, motor cortex is getting activated. See, there is a plus symbol. Motor cortex is getting activated. When motor cortex activates, upper motor neurons activated. Upper motor neurons activated means lower motor neurons activated. That will cause a muscle movement. In direct pathway, you need to activate the motor cortex. So you have to facilitate it. This basal ganglia facilitates the movements. But in indirect pathway, please concentrate the motor cortex. What is happening to the motor cortex? See, motor cortex is getting inhibited. If motor cortex is getting inhibited, means now it will cause relaxation of the muscles. Relaxation of the muscle. No contraction, relaxation of the muscles. Okay. Now, let's start with the direct pathway first. Okay, now let's start with the direct pathway. In direct pathway, what is happening? Okay, in direct pathway, now you are having a thought. Okay, for example, let's start like this. You are having a thought. Now, the thought is, for example, you have to like stand and you have to walk. Okay, you are having this thought. For example, let's do like this. You are having a thought of a motor movement like this. Okay, now the thought is coming in the cortex. Okay, the thought is mainly coming in the prefrontal cortex. It's coming in the prefrontal cortex. You are having this thought. Now that thought need to be converted into actions. Okay, the thought need to be converted into motor action. Okay, you want to do like this. So what will happen? Especially now this prefrontal cortex, it will consult the basal ganglia. Why it is consulting the basal ganglia? Why? Because basal ganglia, the first important point I want you to know, basal ganglia is needed for motor programs. The planning of the motor programs, okay, the planning of the motor programs is done by the basal ganglia. What does I mean by planning of the motor programs? For example, if I ask you, okay, if I ask you to stand and run, now can you do that? Absolutely you can do that. Why? Because you are having that motor program. That program is there. How to stand, okay, how to contract the muscles and how to relax the muscles for running. So for running, you have a motor program is there, how to run. Okay, now for example, if I ask you to do the somersaulting, okay, somersaulting, the flipping back, okay, or like somersaulting. Now, yes, you are having all the muscles, upper motor neurons, lower motor neurons, everything is there, but what is not there? You are not having the motor program. Your basal ganglia is not having that motor program, how to execute this motor action of somersaulting. That motor program is not there. Or if I ask you to do swimming, underwater swimming, okay, all the muscles are there. A swimmer is having the same muscles, I am also having the same muscles. But what is the difference? He is knowing this program, how to swim. Okay, that motor program is there in his basal ganglia. So now when he is getting this thought, like I want to swim. Now when he jumps, what happens? Now the cortex is consulting the basal ganglia. Basal ganglia will activate the motor cortex. What it will do? It will activate which muscles are needed, how much flexion is needed, how much extension is needed, how much tone is needed. All that will be controlled by the basal ganglia. Okay, so basal ganglia, it contains what? It contains the motor programs. Planning of the motor programs is done by the basal ganglia. But anyway, now let's start our topic. Now you are having a thought. Okay, you are having a thought. Now you need to do some action. Now how it will be, like how the action will be executed, we will discuss. But before that, I want you to know some points. See, thalamus, okay, here is the thalamus, here is the cerebral cortex, striatum is here is the globus pallidus, internus, and substantia, nigra, pars reticulata. Now these are the different structures present, different structures in the basal ganglia we have seen. Now these are the structures in basal ganglia. Not only that, we are also having some other structures like thalamus and cerebral cortex. Now all the time remember, from the thalamus there are excitatory projections. See, from the thalamus, excitatory projections are going to the cerebral cortex. See, from here also the thalamus, from thalamus, excitatory projections are going to the motor cortex. So thalamus activates the motor cortex. Okay, done. But normally, let's start from here. See, thalamus is kept inhibited. Okay, thalamus is kept inhibited. Who? By globus pallidus internus. Okay, globus pallidus internus. Okay, and substantia nigra pars reticulata we have seen. Now they will produce which neurotransmitter? They will produce a neurotransmitter called as GABA. Okay, they will produce a neurotransmitter called as GABA. So all the time, now this globus pallidus internus and substantia nigra, what they are doing? They are producing GABA. So now these GABAergic neurons, what they will do? Now these GABAergic neurons will inhibit the thalamus. Now when the thalamus is inhibited, now there is no excitation to the cortex. So cortex is also inhibited. Initially the motor cortex is inhibited. That's what we are discussing. Okay, all the time the motor cortex is inhibited. But now what is happening? Now see, you are having a thought. Okay, in the prefrontal cortex thought is coming. Now this prefrontal cortex will directly activate the motor cortex. No, the prefrontal cortex will contact the basal ganglia. Now see, that thought is coming to the striatum. Okay, now striatum is activated. Why? Because cortex, the prefrontal cortex. Now this prefrontal cortex, now it will release what? Which neurotransmitter? Glutamate. It will also release glutamate. Okay. Now glutamate is being released onto the striatum. Now striatum is activated. What consists of striatum? Putamen and caudate nucleus. Now they are activated. Now striatum, what it will do? Now this striatum we have seen, it will release which neurotransmitter? It will release GABA. Okay, striatum release GABA. Onto what? Now the striatum is releasing GABA onto the globus pallidus internus and substantia nigra pars reticulata. Okay, now what is happening? Now whenever the GABA is being released by the striatum, now what happens? Now the globus pallidus internus is inhibited. Now the globus pallidus internus and substantia nigra pars reticulata are inhibited. Now tell me, whenever they are inhibited, okay, whenever they are inhibited, what happens? See, now they are not releasing GABA. GABA is not being released. Now when the GABA is not being released, what happens? Now automatically thalamus will become activated. Now it will become activated. Now thalamic neurons, now they are activated. Okay, now the thalamocortical neurons, they are excited. Now what will happen? Now thalamus will start to excite the motor cortex. Now it will actually excite the premotor cortex. Okay, so from there upper motor neurons are activated. Now movements are possible. Okay, now if I want to do like this, now the muscle, like the extensors, now the extensors are going to be activated. Okay, movement is possible. But also remember this thing, when you want to do a movement, not only you need to activate the agonistic muscles, but also you have to inhibit the antagonistic muscles. Okay, you have to inhibit the antagonistic muscles. For example, if I am doing like this, if I am doing flexion, now the flexors need to be activated and the extensors need to be inhibited. Now in direct pathway, what we are doing? In direct pathway, we are activating the agonists. Okay, we are activating the agonists. But there is one more pathway which is called as the indirect pathway. So indirect pathway is inhibiting the movements, or I should say inhibiting the antagonists. Okay, inhibiting the antagonists. So how to understand this? See, now here, let's start from this point. Okay, let's start from this point. Now we all the time know thalamus, what it want to do? Thalamus want to excite the cortex. Thalamus want to excite the cortex. Okay, now in indirect pathway, we want the cortical activation or cortical inactivation. We want the cortical inactivation. Why? Because indirect pathway should inhibit the antagonists. Okay, so whenever there is a movement, or at the same time, direct pathway, indirect pathway, both will come into play. Okay, both will come into the play. So here, what should be happening? Now, point is, in the beginning, okay, we have discussed that thalamus all the time want to activate the cerebral cortex. But see, thalamus is inhibited by globus pallidus internus and substantia nigra. So substantia nigra pars reticulata and globus pallidus internus. Okay, what they will do? They will release GABA. Okay, they will release GABA. So the cortex is inhibited. When the cortex is inhibited, the thalamocortical fibers are not activated. So cerebral cortex is inhibited. So how actually this will happen? How means, see, now you are having a thought of doing like this or doing like this. Now this direct pathway is activated. Okay, muscles are contracting, agonistic muscles are contracting, but you have to inhibit the antagonistic muscles. How you will inhibit the antagonistic muscles? Now this thought, okay, this thought of action, the thought of motor action is coming to the globus, is coming to the basal ganglia. Okay, from the cortex, from the prefrontal cortex. Okay, now this information is coming where? To the basal ganglia. Who is the input of basal ganglia? It's the striatum. Yes, we have discussed. Now what is happening? Cerebral cortex, it will release which neurotransmitter? Glutamate. Now this glutamate, what it will do? This glutamate is going to act on the striatum. Now the striatum is activated. Striatum is going to release which neurotransmitter? GABA. So GABA is getting released. Now GABA is released onto what? GABA is released onto globus pallidus externus. Now whenever GABA is releasing onto the globus pallidus externus, now this globus pallidus externus is inhibited. When the globus pallidus externus is inhibited means what happened? Now it is not going to release the GABA. Now it is not releasing the GABA. Okay, generally, see this globus pallidus externus, it produces a neurotransmitter called as GABA, and the GABA will inhibit the subthalamic nucleus. GABA will inhibit the subthalamic nucleus. Now what will happen according to this thought? Okay, now striatum is going to release the GABA. Now GABA is going to inhibit the globus pallidus externus. Now when the globus pallidus externus is inhibited means now it is not going to release. Now it is not going to release the GABA. Whenever GABA is not there, what happened to the subthalamic nucleus? Subthalamic nucleus is activated. Now subthalamic nucleus, what it will do? Subthalamic nucleus, it will produce glutamate. Onto which part? Now the subthalamic nucleus, it will release glutamate onto globus pallidus. Now the globus pallidus internus is activated. So how globus pallidus internus is activated? Globus pallidus internus is activated because of the subthalamic nucleus. Okay, so subthalamic nucleus, that is like from the subthalamus to the globus pallidus internus. Okay, subthalamic nucleus to the globus pallidus internus, the neurons are coming. Now they are releasing the glutamate. This glutamate is going to activate the globus pallidus internus. Now what this globus pallidus internus will do? It will release GABA. So that thalamus is inhibited. When the thalamus is inhibited, now the cortex is not activated. Which cortex? Motor cortex. Okay, that motor cortex which is activating the antagonists. Okay, that motor cortex which is activating the antagonistic will be inhibited. So that motor neurons which will activate the antagonists will be inhibited. So motor movement is possible. So whenever you want to do a motor movement, okay, you need to activate the agonist and you need to inhibit the antagonist. So that will be done by both the direct as well as indirect pathway. So at the end of the day, what I want to put into your mind is, see in direct pathway, for example, first let's discuss about the indirect pathway. See in indirect pathway, what is happening? In indirect pathway, the globus pallidus internus is activated. Okay, see, note, the globus pallidus internus is stimulated or activated in indirect pathway. So when the globus pallidus internus is stimulated, cortex is inhibited, the thalamus is inhibited, automatically cortex is inhibited, motor cortex is inhibited. So movement, like inhibition of the movement. Inhibition of the movement means inhibition of the antagonist. That's what I mean. Okay. Now direct pathway, what is happening in direct pathway? Indirect pathway, the main point is you need to inhibit. Okay, you need to inhibit the globus pallidus internus. If you inhibit the globus pallidus internus, what happens? Now thalamus is activated, now cortex is activated. Like movement, like movements are possible. So indirect pathway, what do you need? The globus pallidus internus need to be inhibited. In indirect pathway, the globus pallidus internus should be activated. So that's the important point which I want you to know. But anyway, not only this, see this substantia nigra, this region, this substantia nigra, okay, pars compacta, substantia nigra by producing dopamine. Okay, substantia nigra by producing dopamine will influence, see substantia nigra by producing dopamine will influence both the direct pathway as well as indirect pathway. Okay, substantia nigra by producing dopamine activates, see, substantia nigra by producing dopamine activates the direct pathway, So now tell me, substantia nigra, dopamine activating the direct pathway by acting on D1 receptors. Here D1 receptors are there. Substantia nigra produces dopamine acts on D1 receptors, so it is stimulating the direct pathway. If direct pathway is stimulated means it is stimulating the movements. So for the movements you need to have dopamine. For example, imagine if there is any damage to substantia nigra, the dopaminergic neurons are damaged, the dopaminergic neurons are dead. So what happened to the dopamine levels? Dopamine levels decreases. And when the dopamine levels decreases, see the positive stimulation is not coming. So in the direct pathway, the positive stimulation is not coming. Why? Because dopamine gives a positive stimulation. I have explained to you. Dopamine activates the direct pathway. So in Parkinsonism, whenever there is damage to the dopaminergic neurons, no dopamine means no movements. So that's why in Parkinsonism, The person will be having difficulty to initiate the movements. Whenever he try to initiate the movements, he is going to have tremors. He is going to have tremors. So in Parkinsonism, what happens? Dopamine levels decreases. Direct pathway is not getting activated. When the direct pathway is not getting activated, it's difficult to initiate the movements. Okay, so here I have given the summary. See, what are the functions? The functions of the basal ganglia. So the functions of the basal ganglia is how many pathways are there? Two pathways are there. Direct pathway. Okay, this is direct pathway. Okay, there is no gap. Okay, it's a direct pathway and indirect pathway. Two pathways are there. Direct pathway and indirect pathway. What is the purpose of direct pathway? It stimulates the motor movements. Okay, it stimulates the motor movements. And the purpose of the indirect pathway is inhibits the motor movements. Okay, inhibits the motor movements. Okay, stimulates the motor movements and inhibits the motor movements. Now, dopamine, yes, we have seen dopamine is coming from where? Dopamine is coming from the substantia nigra. Okay, dopamine is coming from the substantia nigra pars compacta. Now, this dopamine, what it will do? It will stimulate the direct pathway by acting on D1 receptors. Okay, by acting on D1 receptors, it stimulates the direct pathway. By acting on D2 receptors, it inhibits the indirect pathway. Okay, it inhibits the indirect pathway. But at the end of the day, one point I want you to know is, so dopamine stimulates the direct pathway. If the direct pathway is getting stimulated, movements are stimulated. Okay, movements are stimulated. Now, so dopamine is what it will do. It will facilitate the motor movements. So loss of dopaminergic, okay, loss of dopaminergic neurons from substantia nigra will cause which disease? Parkinsonism. Okay, Parkinsonism. Okay, the person will be having tremors, especially the pill rolling tremors will be there. Okay, no muscle movements will be there. Even the facial expression is not going to be there, so that these patients are going to have masked face in Parkinsonism. Now, see, what I am trying to say is mainly the basal ganglia is inhibitory in nature. Basal ganglia is inhibitory in nature. It inhibits. Okay, it inhibits the movements. Whenever resting, it inhibits the movements. It inhibits the involuntary movements. Now, my question to you. If there is any damage to basal ganglia, okay, if there is any damage to basal ganglia, what will happen, sir? If there is any damage to basal ganglia, unnecessarily the movements will be produced. So there is involuntary movements in the body. So damage to different parts of basal ganglia will cause different types of involuntary movements. That's what we will see now. Say lesions in the basal ganglia. If there is a lesion to the caudate nucleus, okay, if there is a lesion to the caudate nucleus, then there will be abnormal involuntary movement, involuntary movements will be seen. So caudate damage will cause chorea. Okay, chorea. Damage to C for C. Damage to caudate will cause chorea. And damage to globus pallidus. Okay, globus pallidus. Now damage to globus pallidus will cause ethetosis. This is also an involuntary movement. Okay, an abnormal involuntary movement, a type of involuntary movement, writhing kind of movement, something like this. Okay, so globus pallidus damage will cause ethetosis. And subthalamic nucleus, any lesion to subthalamic nucleus, what happens? There will be hemibalismus. So these are the different types of abnormal movements which are seen due to damage to the structures in the basal ganglia. Okay guys, hope the video is helpful. Okay, thank you.